Welcome. You're listening to the Keeping Ashland Healthy podcast, a podcast production of the Mental Health and Recovery Board of Ashland County, Ohio. Thanks for joining us. And welcome back to another episode of the Keeping Ashland Healthy podcast. On today's episode, Dr. Ashley and I discussed three great programs of the Mental Health and Recovery Board, and we wanted to cover recovery housing, hospital liaison services, and our community resource and referral. Hopefully, folks will either learn a little bit about something they did not know or learn more about something maybe they had heard of in today's episode. Regardless, I hope that our audience has a better understanding of how to use these resources that are a real advantage to the community. Thank you for listening. Well, good morning, Dr. Ashley. How are you doing this morning?
I'm doing great. How are you doing this morning? That's the question.
Yeah, that is the question. I'm doing well, Dr. Ashley. We appreciate you joining us, audience, for another edition of Keeping Ashland Healthy. Today, I'm excited, Dr. Ashley. We are going to talk about some of the programs and services that the board funds.
Yeah.
A lot of people don't know that we have just about 50 programs and services.
I would say most people don't know that. That is a lot of programs and services for sure.
So, we're not going to talk about all 50 today, Dr. Ashley.
We could.
We could.
Got time.
That would be a long podcast. True. But we do want to begin to discuss and educate the public that these services exist and just a high-level view of how they exist. For the purposes of access, general education. My hope is that if folks hear about something that they weren't aware of before, that they could either call the agency or call the board to get additional information for either themselves or a loved one. So the whole idea is, yes, what are the types of programs and services that are funded by the board, and how could somebody access those if they were at all interested? So you ready to dive in?
I'm ready. Yep.
Okay.
Let's do it.
Well, our first program is through ACADA. So again, the board contracts with three agencies here locally in Ashland County: ACADA, Appleseed, and Catholic Charities. This first program is at ACADA, and it's called Recovery Housing.
Yes. What's recovery housing?
Well, I'm glad you asked that, Dr. Ashley. So the idea sometimes when an individual is in recovery from substances, there's a lot of things going on where the person is, yes, they're getting treatment services, individual group services, sometimes medication-assisted treatment if the issue was opioids. But as you might imagine, Dr. Ashley, again, we're both therapists. When we work with individuals in recovery, all aspects of their life sometimes needed to be rebuilt. So sometimes there were financial issues, sometimes there were legal issues, relationship issues.
Definitely.
But another big area had to do with housing and where are they going to live while they're in this recovery process. So some years ago, the board began talking with the director of ACADA at that time about developing recovery houses, which was basically a place, temporary, short-term housing for individuals that were in recovery that didn't have a place immediately to go and live, but we wrapped services at the house and around the house. It created an environment within the house of 2 to 3 different people that are in that same stage of recovery that all understood that this was an opportunity for them to continue to work on the recovery, all the treatments, all the self-help, but have a safe place to live, begin work again, start to save money, with the idea being at a point in the future, and hopefully not too distant future, they would be able to move out of the recovery house into more of a permanent placement.
Yeah, I think that's great. It's like a transition sort of. So they're going from a place of, using, and then they have this kind of step down to like they're in recovery and they're out of that system now, but they're still being supported. So they're not just back thrown into the world doing it on their own.
Exactly.
So I like that it's kind of transition space for them.
Yeah, and I like it because it's incremental. So one of the things we've heard a lot about is when somebody is in recovery and they're dealing with so many things all at the same time, it's overwhelming and it makes relapse and failure more likely. So for instance, if you're trying to work out all your relationship issues, you're trying to stay clean and sober, you're trying to find a job, keep a job, do well at a job, also secure, housing and food, and deal with legal challenges, deal with if you have a spouse or boyfriend, girlfriend, or kids. All those things they're trying to juggle simultaneously. So it can be overwhelming, and it can be, I think, a trigger for a slip or a relapse. So, allowing more of a safe space to land with the housing, I think, can allow them to focus on some of those other areas.
Absolutely. And also to add to that, when you're using substances, the environment has a lot of triggers and cues in itself, right? So being in that same environment can be triggering, and if you're trying to stay, clean and sober, not using, it can be harder in that old environment. So it provides a new space. Yeah.
I'm glad you brought that up because there's no use at the houses. So they maintain in their sobriety when they're in the houses, in that recovery environment. There's a and again, the current director at Acada is Rick Ford, and he's got Lori, who's a peer recovery supporter, who she's in that house. She's working with the folks individually and in groups, and she really creates, I think, a great environment for recovery to happen.
Lori's great.
Yeah, she is. Yeah. So again, this program at Acada, 419-289-7675 is Acada's number, and we'll put all this in the episode description, but this would be, so if you're listening, either yourself or somebody, if the person is serious about their recovery, they're engaged with treatment services at Acada, and again, this would be primarily for folks that are engaged with treatment at Acada. They could be involved with other services too, but I think Acada has to be one of the people they're involved with because Acada owns the houses and operates the houses. You want to give them a call. Talk to Rick Ford at Acada about, does this make sense for me? Again, it's short term. The rents, how much is paid, can be as low as zero. So they work on that. So they want the person to be successful, and we know that safe housing is a key part of recovery, and folks need the help. And I think we've been doing these for about 3 or 4 years, and they've seen quite a bit of success. I won't say that everybody comes in, gets out of the house and is successful, but by and large, most of the folks that are going through this recovery house program is successful in their recovery.
Yeah, that's great.
So talk with Mr. Ford. I think folks, it's one of those things that a lot of people don't know about, but it's a critical part for a lot of people in their recovery. So recovery housing through Acada. Our second service and program that the board funds that I wanted to spotlight, Dr. Ashley, is over at Appleseed. Again, Appleseed's one of our largest contract partners, and they have a program and a person that we call the Hospital Liaison.
Yeah, that's a fancy name.
Right? Sounds fancy.
Yes.
So let me explain this to the audience a little bit, and hopefully they can see why this is such a critical position. So crisis services. So if you or a loved one is experiencing what we call a psychiatric or emotional crisis, again, this is usually when the person, not always feeling like they want to harm themselves or somebody else, but they're very out of sorts. They're not sure, that they can function, they can live in their own house, they can interact, go to work, all the things that they want to do. They're just struggling in the moment.
Struggling to cope, really, with something.
And again, I'm a little bit, I don't want to be too specific because everybody defines crisis a little bit differently.
Yeah,
and
right.
And the hospital liaison, we wanted somebody in charge of crisis services in our county that could kind of, oversee it all, the whole process. Not only does this person engage with persons that are in crisis, but she also oversees the workers that are doing crisis services. So it's good to have somebody that kind of oversees and supervises all the crisis services that the individuals are receiving. But then also, Dr. Ashley, where do people go? So sometimes we've talked about hospitals, where somebody who might be struggling in crisis needs to go to either the state hospital in Massillon or a private psychiatric hospital. They could go to somewhere like Ohio Hospital over in Mansfield. That's probably the closest private or hospital-based. And we wanted to make sure we had somebody that was coordinating with all those different hospital systems, the workers there, to make sure that folks are treated well. So if you're from Ashland County and you do need to go to one of those places, whether it's a state or a private hospital, that the services you receive are quality services, good services, helpful services. So we really wanted to have somebody who could monitor all of that, could actually talk to you or your family members about your experience to make sure, and if there were issues, that she could take those back to that that hospital to talk those through to see if we can't make any improvements.
Yeah, it's great that she's like communicating and helping. I mean, when people are going into the hospital, when they're coming back out, I think it's a really helpful position. So.
Yeah, I agree. And again, we've had instances, just so the audience knows, where, and her name's Pam right now. Pam is our hospital liaison.
Yeah.
If Pam doesn't feel like our folks are getting the right kind of care, we just don't admit there. So we take that off our list until they get their act together.
Yeah, because we want people to have the best care that they can, right?
Yeah, one of the standards is, listen, if I wouldn't go there, or my mom or my relative, if I wouldn't put a family or friend or recommend it to a family or friend, why would I recommend
Absolutely.
it? So that's kind of our standard, and I think that makes sense to folks. We want to do our best to make sure that the services we're recommending and referring individuals to are quality. You're going to get help, respectful help, timely help, efficient help, et cetera. So the hospital liaison kind of stands above all the crisis services, coordinates with all these professionals at the different hospitals. Some of the other important things we don't talk about a lot because it hasn't, because of a lot of circumstances, that hasn't been such an issue. But the hospital liaison works on discharge planning.
Right.
And what I mean by that is, so if the person's in crisis and it seems like a hospital placement would be a good idea, and usually Appleseed will facilitate that admission, well, the hospital liaison is working to make sure that the person doesn't stay there too long or too short. And I say too short because, Dr. Ashley, as you know, because we've got such capacity issues in Ohio right now, more often than not now, people are being discharged quicker than maybe they should be, just because they're at such capacity, there's such demand for the limited number of beds that we have in Ohio that folks sometimes they're not getting a whole lot of help before they're discharged. So we want to make sure that the person isn't kept for too long, which used to be a problem years ago. But on the flip side, we want to make sure that they're not discharged like immediately.
Right. Yeah, that it's actually helpful for them.
That's actually helpful. So
that's great.
That's another thing Pam does, is she monitors what we call length of stay. So the length of time somebody is actually in the hospital setting. So in addition to coordinating the care, just that length of stay, making sure that any changes with medications, other changes that might have occurred or started, that gets communicated back to whoever's going to follow up. Because if somebody is going to go to a hospital, whether it's private or the state, we want to make sure that there's a plan when the person comes back to the community to follow up, to make sure that person gets the support, the skills, tools, whatever they need to be successful. Because you and I train on QPR all the time, and one of the things we say is, most folks that maybe are feeling suicidal, that's a once-in-a-lifetime kind of situation for most folks.
Right.
We rally, we get all the supports around that person that we can, and usually that's a one-time event for that person. They're going through a particularly challenging time and don't feel like their coping skills were sufficient, and they might think about harming themselves, because they just can't see the other options that are available. But once they get that support, folks going forward don't usually end up in that same place.
Yeah, so that aftercare is important. So, going forward, they have the support they need, and it doesn't end up like they're back in this cycle of going to the hospital, right? You're actually resolving something.
Exactly.
Yeah.
And individuals that are going to the hospitals, more than once in, say, a 30 or 60 or even 90-day period, that would rise to the attention of the hospital liaison. What that would tell her and us, if somebody is returning to the hospital again and again, that would tell us we are failing that person and their family in some major way. So we need to get to the bottom of that.
Absolutely.
I can tell you the good news, Dr. Ashley, since we implemented the hospital liaison, and this goes back several years, we've really cut that to a minimum. It's very rare that somebody goes multiple admissions to a hospital in Ashland County. And I wanted the audience to know that if that were to happen, again, that's not the person's failure. That's our failure as a system. If we're missing something, obviously.
I will say that is unique. To some other counties. Like, so Ashland County has this program, and we see lower numbers of crisis admission here. And I think it's because of the work that the board has done over the years. But other counties I've worked in, it's not necessarily that way, and there is that cycle. So I think, I'm really thankful that we have that here.
Yeah, agreed, Dr. Ashland. So that's the Hospital Liaison Program that is offered through Appleseed. Again, most folks that receive services in the county, never end up in the crisis realm. But if they do, ask for the Hospital Liaison. Her name is Pam.
And she's great.
She is wonderful. Last but not least, on our listing of 3 wonderful programs that the board funds is a program through Catholic Charities called the Community Resource and Referral Program. And I'll tell you, Dr. Ashley, the history on this one, again, all these programs have been around for years, and they are really effective. That's why the board continues to fund them. The Resource and Referral, the genesis of this program, and it's kind of a funny story, so bear with me, audience. Occasionally, I would say 5 or 6 times per year, I would get calls from members in the community about impossible situations, individuals that weren't necessarily involved with our system, but they had such challenging circumstances going on in their life that I didn't know where to start.
Yeah.
And a lot of people don't know this, but the boards aren't allowed to provide direct services. And that's really what a lot of these calls would need. They would need like case management. They needed somebody to really dive deep into figuring out more about the situation, what was needed, what was tried, what the resources were, all the things that we're not necessarily allowed to do at the board. But I couldn't, normally what we would do is hand them off to somebody at one of our agencies that does that direct work. But I didn't feel like we had somebody that could really do that because most of the time, most of these calls, these weren't for individuals that necessarily had a mental health issue per se. Yeah. They were just struggling. They were frustrated, and I think their anxiety was increasing because they weren't sure where to go or how to get help for their friend or their loved one. But they weren't somebody that I necessarily thought needed to be a client at our agencies or get a diagnostic label, right? Mm-hmm. They were just struggling, and if they didn't get help, I think they would have increasingly got more and more distressed and maybe would have ended up in crisis like an ER. So we saw the creation of the Community Resource and Referral as a prevention approach. And Catholic Charities really got this because they do a lot of prevention type programming. So the thinking here is when somebody in the community, they don't know where to go for help. And it could be any kind of help. It could be housing. It could be food. Mm-hmm. It could be primary medical health. It could be behavioral health services. It could be any kind of helps. They just need somebody that knows the community like the back of their hand to say, if that kind of help, the best agency to provide help in that area is this agency. Mm-hmm. The best agency that can support you in this area would be that, So they really are that resource and referral hub person. So it's not just behavioral health. It's just all kinds of things that can stress somebody out.
Absolutely. I think those things, so basic needs, food, shelter, clothing, supports, right? If you don't have those over a period of time, it's going to affect your mental health.
Absolutely.
And so I really do think it is prevention.
Yep. Yes. And that was absolutely the thinking of our board. Why should we not try to get ahead of this and help people stay out of a system that they really don't need? If they get those other things, we would never see them, but we might see them in crisis because, as you say, Dr. Ashley, they didn't get some of these basic needs met. So that's not necessarily a treatment program, obviously. And in fact, we don't want it to be, we wanted it to be prevention. So Catholic Charities understood this. Denise is the current resource and referral person there. And this is the agency and Catholic Charities. Again, I'll put this in the episode description, 419-289-1903. Catholic Charities and Denise, the resource and referral person, we read her reports on a regular basis over the years, and you can just see how many folks she's able to help. And the vast majority of those folks don't end up necessarily going to one of our agencies or any agency for behavioral health help, but she does connect them with all the other kinds of resources and agencies in the community, and it really helps them stabilize their life situation.
Absolutely. She knows a lot about what's happening in Ashland County. I love talking to her because I always learn something. So
always. And she's constantly talking to new folks. She's at a lot of the meetings here in town to make sure she knows who's here, because things are right. There's new organizations coming and going. So part of Denise's job is just to stay current on what's available. And that's what's so frustrating. So people, maybe they pick up a flyer that was maybe printed 6 months ago or 3 months ago. They call the number that kind of aligns with what they need, and that agency no longer exists.
Yeah.
Or the person's gone. Things can change quickly. That's why you need a live person who's scanning the environment, trying to figure out, okay, who's here, who's doing what's changed, are the eligibility requirements different? Did they move their offices? All these kinds of things. And Denise is wonderful, and she's so energetic and helpful to the folks that call in. So that's the community resource and referral position at Catholic Charities, and Denise is that worker's name. So, well, there you have it. You've got 3 programs: one at Acada Recovery Housing, one at Appleseed Hospital Liaison Program, and one at Catholic Charities, the community resource and referral. What do you think about all that?
That's a lot of good stuff, I'll tell you that.
It is, and that's just 3. We've got 47 more to go.
Yeah, it's going to be a long podcast, folks.
Well, audience, do not fret. We are not going to do the other 47 programs.
Oh, man.
Over time, though, Dr. Ashley and I will try to remind you of some of the things, and maybe if you didn't hear about these things for the first time, educate you on some of the resources that are provided by our Mental Health and Recovery Board. And again, the board contracts with agencies. We're not allowed to do the work directly. The direct work at the board, if you will, Dr. Ashley, is understanding the community needs and finding the best providers and services and programs to meet those needs. And we do that through our contract partners, Appleseed, Catholic Charities, and Acada. Well, Dr. Ashley, if there is any parting words for the audience, now is the time. You always say something really profound at the end of the podcast.
I don't know about profound, but thank you all so much for your support and for listening.
Thank you for listening.
Thank you for listening to another episode of the Keeping Ashland Healthy podcast. The podcast is a production of the Mental Health and Recovery Board of Ashland County, Ohio. You can reach the board by calling 419-281-3139. Please remember that the board funds a local 24/7 crisis line through Appleseed Community Mental Health Center. It can be reached by calling 419-289-6111. That's 419-289-6111. Until next time, please join us in Keeping Ashland Healthy.